My name is Amy Eldar. I'm an LPN to BSN student at Indiana State University, and today we'll be discussing the dangers of smoking. By the end of this presentation, the viewer should be able to identify the hazardous materials in smoking tobacco, define the highest health risks for tobacco use, analyze the damage caused to the human body from tobacco use, identify the at-risk populations for smoking-related health complications, recognize tools and resources available for quitting and prevention. At this point, please stop here and take the pre-test to assess your knowledge about the dangers of smoking tobacco. The pre-test can be accessed by clicking the link accompanying this presentation. First, we'll take a look and see exactly what is in smoking tobacco. Tobacco is made from the leaves of tobacco plants and contains nicotine, which is addictive and can have both stimulating and tranquilizing psychoactive effects. Tobacco smoke contains many chemicals that are harmful to both smokers and non-smokers that are exposed to it. Tobacco products are manufactured with various additives that are meant to preserve the tobacco shelf life, alter the way that the tobacco burns, control the moisture content, inhibit any insect eggs that may be attached to the plant material, mask the irritative effects of smoking and of nicotine, and to provide different flavors and aromas just for the sake of increasing the pleasure effect. The smoke created when these products are burned have more than 4,000 chemical compounds in them. Many of these are highly toxic and have many diverse effects on health that are negative. Some of these things include nicotine, tar, and the gases that are emitted, which include carbon dioxide and carbon monoxide, both of which are very bad in high quantities for human health. Even though humans have been using tobacco for thousands of years, the health risks of smoking tobacco is often highly underestimated. Smoking and exposure to tobacco smoke causes approximately 480,000 premature deaths each year in the United States alone. Mortality rates among smokers are about 3 times higher than among people who have never smoked. Smoking causes cancers of the lungs, esophagus, the larynx, mouth, throat, kidney, bladder, liver, pancreas, stomach, cervix, colon, rectum, and can cause acute myeloid leukemia. Smokers' risk of developing lung cancer or COPD is increased significantly compared to non-smokers. A lot of people don't realize the impact that will have on their life. In addition to the complications that smoking tobacco can have on your lung and your respiratory health, it also can cause many complications with your heart as well. Smoking is a major cause of coronary heart disease, which is the main cause of heart attack and the leading cause of death in the United States. Smoking also causes high blood pressure, lowers your ability to exercise, and makes blood more likely to have clotting issues. Smoking is a major risk factor for peripheral artery disease, which also could increase the risk of heart attack, heart disease, and stroke. Smoking increases the risk of having an aortic aneurysm, which, if ruptured, is a life-threatening situation. Smoking can cause poor blood flow to your arms and legs, which is called peripheral vascular disease, and this can cause pain in the legs when walking, and it can also cause open sores that don't heal properly. Smoking tobacco can cause a lot of damage to your body. It causes the damage to your lungs and your heart, but it also can cause damage to your brain as well, as it has been known to have limiting effects on the amount of oxygen that is received to the brain and can limit development in the early stages of childhood. So who does smoking affect? Tobacco use is responsible for a large portion of disability-adjusted life years, which is the number of years lost due to ill health, disability, or early death. This graph here shows the percent of total disability-adjusted life years from tobacco use attributed to disease by age. Take a moment to look through it and see what you notice as far as trends go. When you talk about who smoking affects, you have to include everybody. For women, tobacco can damage the woman's reproductive health in addition to damage to the lungs, the heart, and brain. Women are more likely to have trouble getting pregnant, experience an ectopic pregnancy, experience placenta previa, experience placenta abruption, have premature births and low birth weight babies, have miscarriages or stillbirths, have birth defects, and babies of mothers who smoke during and after pregnancy are also more likely to die from sudden death and syndrome. In men, additional risks include higher risk of erectile dysfunction, reduced fertility, decreased sperm count, and increased risk for miscarriages and birth defects that can be passed on from their sperm. Secondhand smoke also causes a lot of disease and premature births in non-smoking adults and children. It increases the risk of heart disease by an estimated 25 to 30% and increases the risk of stroke by 20 to 30% in non-smokers who are exposed to secondhand smoke. Children have a lot of high risks as far as smoking tobacco goes as well. One of the most serious problems is nicotine addiction. It often leads to long-term tobacco use. And there's some evidence that shows that nicotine harms the brain development of teenagers. Children also tend to have increased health issues when exposed or experiencing tobacco smoke. This includes coughing spells, shortness of breath, wheezing or gasping, and these are all aside from exercising or strenuous activity. More frequent headaches, increased phlegm or mucus production, worse cold or flu symptoms, reduced physical fitness, and poor lung growth and lung function. Studies have shown that both behavioral treatments and medications can help people quit smoking, but the combination of medication with counseling is the more effective than leaving one alone. This can be used for both preventative treatments and or to quit smoking if you already are. The best ways to do that are to seek support from family members, friends, and coworkers. Talk to a healthcare provider about nicotine replacement therapy and smoking cessation medications. Join a smoking cessation program to have a better chance of success. Programs are offered by hospitals, health departments, community centers, and work sites. There are many available resources online as well. The U.S. Department of Health and Human Services has a toll-free number that you can call anytime. Smokefree.gov offers resources on how to quit smoking. There's also sources that are available specifically for teens that offer facts on tobacco, nicotine, and vaping or use of e-cigarettes. And there's more information at thetruth.com for information on how you can help prevent tobacco use and the complications that come from advertising and big marketing for corporations that push smoking, especially onto the younger people. At this point, please stop here and take the post test to assess what you have learned about the dangers of smoking tobacco. The post test can be accessed by clicking the link accompanying this presentation. If you would like to print this handout with information regarding the dangers of smoking tobacco and the resources that are available, please use the accompanying link to this presentation.